Good morning, everybody. Welcome to UC Davis. Yay. It really is wonderful to have you all here for the 7th annual AMSA Pre-Med and Pre-Public Health Conference. And, you know, American River College has hosted this for the past 6 years, and we are just delighted to partner with them and host all of you here on the UC Davis campus this year. Now, before I start, I just want to point out, it takes a lot of work to organize a conference like this. And, you know, the students that you've seen who have been welcoming you, they started in April. They worked all through the summer. They met on Friday nights from 6 p.m. to 11 p.m. So much for their personal lives, right? And they organized this, so their dedication is greatly appreciated. And please join me in giving all of them a big round of applause. You are going to have a wonderful, exciting, educational, and inspiring time at this conference. We have an incredible lineup of keynote speakers from the AMC, from the Osteopathic College, from the U.S. Army, from AMSA, from Doctors Without Borders. You have the opportunity to hear from the true visionaries in this field, the people who are defining the future of medicine and public health. It's a huge opportunity, and I urge you to embrace it with all the enthusiasm that you can. Now, I want to just take a moment, though, to commend each and every one of you for your interest in the health professions. You know, a career in medicine or public health, it's a lot of hard work, isn't it? But it brings opportunities for fulfillment that you can only imagine. And I'm here to tell you that all the hard work you're doing today and all the hard work that you will be doing in the years to come is worth it, because this profession is the opportunity to change the world, to make our society a better place, a more equitable place, by making it a healthier society. Now, here at UC Davis, and frankly, you're going to hear from deans from so many schools, and each one of us are going to kind of pitch our own schools. So I'm here to pitch UC Davis, okay? I just want you to know that. Cards on the table. At UC Davis School of Medicine, we impress upon our students that what we're about is combining academic excellence with a passion for social justice in order to transform healthcare and improve health for all. And to do that, that means that your education is about a lot more than learning facts. The facts are important because you got to have the knowledge to take care of your patients. But it's about learning and embracing a set of values that you take responsibility for when you're trusted by the public to be a doctor or a public health practitioner. And we tell our students that the reason you are doing this is to serve your patients in the future, to serve your communities by working and advocating to make healthcare more equitable and effective. Now, today, and you all have been watching these debates, people across our country are crying out for healthcare reform. It seems like everyone understands that we need to fundamentally reform our dysfunctional healthcare system. They want us to move from a fragmented, poorly accessible, and tragically expensive system to one that meets the needs of patients through having a primary care doctor, a medical home, by giving attention to prevention and wellness, to looking at the public health of our communities, and to have a global perspective. And now you in this room are the future leaders of that reform. You are the ones who will transform our systems to ensure better health for all. And when I look around and see all of you out there up at 8 o'clock in the morning on Saturday to have this experience, I feel really confident about the future of healthcare reform. But I want to leave you with this thought. In our world today, health is determined only in small part by healthcare delivery systems. Only about 15% of the health of a community is due to the hospitals and the doctors and the nurses. We now understand that the health of a community is actually really determined by factors like job opportunities, socioeconomic status, poverty reduction, education, access to safe housing and healthy foods. These are called the social determinants of health, and there is a growing recognition that these factors are the things that we must all come together to address. So if you are in this room because you truly want to improve the health of our communities, please lead the discussions beyond discussions of health insurance and embrace a moral imperative to assume a broader role, each and every one of us, to address all of the social determinants of health. As you listen today, and as you pursue your studies, please remember that we must all come together to transform the system. It will require providers from all of our communities, from all backgrounds, from all walks of life, and I am absolutely thrilled to see such a diverse group of attendees here at this conference today. You have an opportunity to do a tremendous amount of good. And I urge you to seize upon those opportunities. Be here to learn, be bold, be courageous, be caring, and define that brighter, more equitable, and healthier future for all. Once again, welcome to UC Davis. Have a wonderful time at the conference.